It's a first of its kind study looking at women's heart health during pregnancy. It found those 9 months are a critical period, not just for mom, but also for her unborn baby. Sarah Daloff explains.
Pregnancy is an exciting time, but it's also stressful emotionally and physically for expectant moms.
Her body has to carry around more weight, she has to process more energy to feed the baby, and her heart has to pump more blood. So pregnancy can reveal her underlying cardiovascular risk.
But the current state of heart health in pregnant women in the U.S. is far from ideal. A new study published in the Journal of the American Heart Association looked at 1,000 expectant moms and found just 5% had high cardiovascular health. 60% were considered moderate and 35% were considered poor, not only putting moms at risk, but also their unborn children.
The maternal environment as the baby grows and develops can actually program the baby's later cardiovascular health. So you can think of it as sort of writing a computer program that then runs throughout the baby's life and determines that baby's subsequent risk for cardiovascular disease after they become an adult.
Heart health was worse among younger pregnant women and African Americans. However, the study's authors say more research is needed to understand why. Overall, they looked at 7 key metrics, things like diet, exercise, weight, glucose, cholesterol, smoking, and blood pressure.
Overwhelmingly, it was diet and physical activity that were worst among pregnant women.
Health experts say expectant moms should speak to their doctors, but a diet high in fruit, vegetables, and lean proteins, along with moderate exercise, can help keep a heart healthy through pregnancy and beyond.
As for exercise, the study found only 25 women were getting 150 minutes of physical activity every week. Half of them said they didn't exercise at all. Of the hundreds of Americans quarantined on a cruise ship in Japan, 14 of them have tested positive for the coronavirus. All of them have been brought back to the U.S. Those who tested positive for the virus were placed in isolation chambers on the planes for the 12-hour flight and are now being treated at the University of Nebraska Medical Center. The other passengers were taken to military bases in Texas and California, where they will spend at least 14 more days in quarantine. Meanwhile, more than 1,000 others are quarantined on a cruise ship off the coast of Cambodia. All 2,200 passengers and crew on the Westerdam were screened for the virus before docking in the country. The company was letting people get off the ship until an 83-year-old American woman tested positive for the virus after flying to Malaysia. All remaining passengers and crew are now stuck on board and are undergoing further testing.